Hey, Dr. Naeema here. Welcome back to NeuroInsights with Dr. Naeema, where we talk about brains, behavior, and how to make the science make sense. Make it make sense, right? I am your host, Dr. Naeema, clinical, school, and neuropsychologist. I practice applied behavior analysis and neurofeedback as well. Additionally, I'm a part-time coffee enthusiast, full-time advocate for clarity in chaos, and full-time boy mom and rabbit mom. Today, we're diving into a big one, a question I get every single week from overwhelmed parents, teachers, and even fellow professionals or colleagues. What therapy actually works for people on the autism spectrum? So, this is children, adults, people on the autism spectrum. I'm here to tell you, I'm so sorry. Spoiler alert, it's not just one. Autism is complex. And so, the treatment journey is as well. But not don't worry, we're going to break it all down, evidence-based style. Let's untangle this therapy jungle together. So what is evidence-based anyway? Let's start with the basics. Evidence-based does not mean trendy or it worked for my cousin's neighbor's dog trainer's kid. It means rigorously tested and shown to be effective in controlled studies where it comes to autism. And we've got a solid toolkit, but it's not one size fits all, y'all. Every person that you meet is not the same individual and does not have the same needs. And that's where something called the neuropsychological evaluation comes into play. It's like the roadmap to the therapy world. Without it, you're just guessing which highway will take you to grandma's house. Now, you know you're trying to be in Brooklyn and you might end up in Cleveland, Ohio without a neuropsychological evaluation. What is this magical neuropsych eval? Think of it like a full workup on how the brain processes information. We're looking at cognitive strengths and weaknesses, executive functioning, language skills, social cognition, emotional regulation, and academic abilities and vocational abilities for adults. It helps us figure out why a child is struggling or person is struggling, not just that they are struggling. And once we have the why, we can pick the right therapeutic tools. For example, if I see a child has strong verbal reasoning skills but poor emotional regulation, I might lean more into the CBT. If expressive language is a challenge, speech therapy is going to be a game changer for this particular individual. It's not guesswork, it's matchmaking, but for therapy. And trust me, matchmaking the wrong therapy is like setting a vegan up with a barbecue pit master. Doomed, doomed. Doesn't matter how great they are, it's not going to work. So let's meet the therapy lineup, starting with ABA therapy, applied behavior analysis. Now, most people know that ABA therapy is the gold standard for an individual with autism, especially for young children. It focuses on teaching specific skills through reinforcement. It's structured, measurable, and goal driven. Now, I know ABA can get a bad rap. Some people think it's robotic or it's too rigid, but good ABA, the kind that adapts to the child or individual, builds relationships, includes play, and respects neurodiversity. Now, that's powerful. Real talk, y'all. I once had a child who refused to do anything without his Spider-Man mask. We ran half of our sessions with me in a Hulk mask. He learned to tie his shoes, brush his teeth, and eventually to do it without the costume. We celebrated every step. Then there's cognitive behavior therapy, or CBT. CBT is all about changing thoughts to change behaviors. It's best for older children, teens, and adults with autism who have enough verbal reasoning to talk about feelings and their thoughts. It helps with anxiety, rigid thinking, and meltdown. One of my clients called it thought training for boss battles. Honestly, that's not wrong. Then we have parent management training, or PMT. This one's a hidden gem. PMT teaches parents how to reinforce good behavior, set limits, and reduce problem behaviors or maladaptive behaviors. Here's the secret sauce. Even the best therapy for 2 hours a week can't compete with 166 hours of inconsistent parenting. Parent follow through is everything. I had one mom who kept saying, I tried the token system, but he just throws the tokens. So we practiced, tweaked it, added some Minecraft rewards. Boom. Tokens became golden bricks to screen time heaven. Everybody wins. Then there's family therapy. You must understand that autism does not just impact the individual, it shifts the whole family system. Siblings get jealous, parents disagree on strategies, and everyone's tired. Family therapy helps align expectations and keep everyone from burning out. Think of it as oiling the gears of the support machine. Now, let's talk about our therapy sidekicks. Also vital in the big picture, there's occupational therapy or OT. This helps with sensory issues, motor coordination, and daily living skills like handwriting, dressing, and yes, tolerating a haircut without going full Godzilla. Speech and language therapy, not just articulation therapy, it's also about communication. Some children need AAC devices. Others need help with pragmatics or the social aspects or social use of language. One little guy I worked with would talk endlessly about dinosaurs, but could not answer the question, how are you doing today? How are you? Speech therapy helps bridge that gap. Then there's one of my all-time favorites, neurofeedback. This one's still emerging, but neurofeedback uses EEG to help train brain wave patterns. Think of it like brain yoga. Some studies suggest it may help with attention and self-regulation, especially in children with both autism and ADHD. And I use it in my practice, and I've seen it make progress for a lot of people or help a lot of people to make progress. It's promising, but still developing. I say use it as a supplement, not a replacement. Then there's parent training programs, the underrated MVP. We're going to dive back into parenting for just a second. Programs like Incredible Years, Triple P, which is Positive Parenting Program, or PCIT, Parent Child Interaction Therapy, these teach real strategies you can use daily. They help reduce tantrums, increase cooperation, and this is a big one, lower parental stress. How many of y'all can use lowered parental stress? I've had parents come in saying, he just doesn't listen to me. After 4 weeks of coaching, he still tests me. But now I got a game plan. It's empowering, and honestly, parents who go through training feel more confident. And that confidence changes everything. So, if there's one takeaway from today, it's this: therapy only works when it's consistent, tailored, and supported at home. It's not about doing everything, it's about doing the right things based on your child's unique needs. And hey, you don't have to figure it all out alone. Find a good clinician, ask questions, and don't underestimate the power of showing up every day, even when it's messy. Trust me, I've had sessions with children throwing goldfish crackers at my face. We still made progress. They ain't doing no more, but we still made progress. Thanks for hanging out with me on Neural Insights with Dr. Naeema. If you enjoyed today's episode, don't forget to subscribe and like, leave a review, and share it with a fellow parent or therapist who's trying to navigate the autism therapy maze. Follow us on YouTube, Dr. Naeema Giving Hope, on Instagram, Dr._Naeema_ and Giving Hope LLC. And remember, brains are messy, beautiful, and worth understanding. I'm Dr. Naeema. I'll catch you next time for more insights with Dr. Naeema more stories, and a few more goldfish battles. Stay curious, stay kind, be blessed, and continue to be a blessing. Until next time.